consistent rain here continues. That's good news for us this summer.
Exactly. All right. Thank you, Laura. Well, it's something that's quite common, especially as we age. We're talking about urinary incontinence or the loss of bladder control. And for some, it can be embarrassing. However, there are some ways to help with the problem. Joining me today is Dr. Cynthia Fok from the U of M with more. Thank you so much for joining us. What causes this?
Well, thank you for allowing me to talk about this very common problem that affects millions of adults. And there are a lot of different causes to this, from things that we eat and drink, low vitamin D levels, surgeries, and even nerve and muscle problems. So there's a lot of different things, but the good news is there's also a lot of different treatment options. From medications to pelvic floor therapies to work on retraining those pelvic floor muscles, or even surgeries. But one of the newer options that is now out there is actually an office-based procedure that we can offer called Urgent PC. And it's a small acupuncture type needle that actually gets placed on the inside of the ankle.
That's amazing, because when I looked at the video, it was like it was just on somebody's foot, and that this was just to the side of it.
Right, and they come in for a half-hour treatment, and essentially this little needle will stimulate the nerves that go back up to the bladder, with help to sort of reset those nerves to help people with some that gotta go type of urinary leakage.
Because you said your brain is kind of like saying, no, you don't have to go, and your bladder is saying you have to go. So this kind of interrupts that system, that series?
Right, it helps reset it back to how it's supposed to normally work, where you actually have the urge to go and you can get to the washroom in time.
Okay, so after that, after you've gotten, it's called Urgent PC therapy, because I know people want to know about that. You also say take vitamin D. And what age do you need to take this?
Well, I think that for any of this, you should first make sure you see a healthcare provider. People shouldn't just go start taking vitamin D.
Right.
But they showed as we've gotten older, people with low vitamin D levels are more likely to have urinary incontinence. So it's really just keeping a normal level of vitamin D.
And then you say for over age 60, it's even just a little bit more. So if it's 1,000 below that age, then it's just a little bit more after that age?
So, right, and it's the nice thing is you can actually, there's a blood test to test your level of vitamin D. And so that's how the treatment gets altered depending on what your levels are.
Now, and then there's also something called Kegels. And then what is that? And then how would that help women?
Great. So Kegel Exercises, most of us women have heard about, and they work on people with stress incontinence or coughing, sneezing, leakage. Essentially, if we think about from being pregnant, childbirth, those muscles have gotten a little bit weak, and it helps to retrain those muscles so they can work again. So when we cough and sneeze, we can actually hold back that urine.
So that's in the pelvic floor area. Okay. So then after that, then you brought some examples of be careful on what your intake is, especially on liquid. So why don't you give us a little look at that?
Yeah, so one of the important things is clearly when it's hot weather like this, you're going to be drinking lots of water, but too much water can simply overwhelm your bladder. Other things we all like are sodas and our coffee, but those are clearly other things that are very much irritants to the bladder. Alcohol can be as well. And then things like spicy foods or very acidic foods like tomatoes, orange juice, these types of things, for some people they can have sensitive bladders and they can make their symptoms worse.
And then finally you say keep a diary. I thought this was kind of interesting. So why keep a diary?
Well, a diary, two things. One, it helps you kind of keep track of things that you're eating and drinking and doing that may be making your symptoms better or worse. And it also is something very helpful for you to bring into your provider to talk about, because it helps him or her better understand what your urinary symptoms are.
And kind of narrow it down a little bit.
Yeah.
All right. Thank you so much for joining us. We really appreciate it.
Again,
for more on what we just talked about, head to KARE11.com, click on local, and then the 4 p.m. news. Well, still ahead on KARE 11 News.